Hi, my name is Eneh Jones O'Day, and I am a doctor. I'm also an image consultant and personal stylist. And I've been doing medicine for, 14 years now, which is very interesting, actually. It doesn't feel that long, but it's gone by really quickly. And I've been doing personal styling since the pandemic.
So what does the name Eneh mean?
People don't actually ask that most of the time, but it means mother. And I'm not a mother yet. So for me, it gives me hope for the future. It's something to look forward to. I am excited about what I will be like as a mum. I do have 2 nephews, and I see how my sister parents them really well as a mother. And I actually learn a lot from her. But yeah, my name means mother.
And okay, so what's the best advice, Eneh, that you think you've ever received?
Oh, wow. The best advice I've ever received. There's a lot. I would say from a faith perspective, I'm a Christian and I believe in God. So I think the best advice I've received in life is to put all my faith and all my trust, my identity in God, not in my job, not in my work, not in my title, not in my looks, not in money, not in anything. So I would say that's been the best advice, to have a sincere, true, and intentional relationship with God and seeking Him first in every area of my life.
And what decision most changed the trajectory of your career, and what's helped you make it more confident?
Oh. So the decision that has most changed the trajectory of my career would be changing career paths within medicine. So I previously trained as an eye surgeon, and I worked really hard towards that from medical school, did 2 years of general medicine, general surgery, and then did a year of research in eye surgery to be able to get a job in eye surgery, which is very competitive in the UK. So usually, at the time, it was one of 90 jobs in the country. And I was really excited at the time to get that post. And I enjoyed eye surgery. I loved it. You basically got to work with lasers, with microscopes. You got to do really cool surgery with people awake, and you made a significant difference to people's lives by restoring their vision or preserving their vision. So I changed jobs from eye surgery to occupational medicine, mainly because I found the other aspects within eye surgery quite exhausting. We had long hours, very long on calls, and I was away from family at the time. So I was in Cornwall and in Devon, and my family are in the southeast of England. So separation from them and also feeling burnt out, actually, if I'm being honest, did, inspire me to make the change. However, I would say, even though it was a difficult decision at the time, it was very hard, I feel like it was the right one for me to make. In terms of how that decision has increased my confidence, is I've been able to just trust my decision making and trust that I made the right decision for myself at the time. A lot of people questioned whether that was appropriate, or, giving up a job that I worked really hard to get into was the right decision, and maybe just sticking it out. However, it actually opened the door for me to specialize in another aspect of medicine. So I was able to widen my skills, but also it challenged me to start my business as a personal stylist and an image consultant. So prior to the pandemic, I would do that informally for friends, for family, relatives, and I really enjoyed it. And during the pandemic, I had some time to reflect and just think about doing something outside of medicine that was creative, that would be fun for me and not feel like work, but will also impact people's lives positively and also help build their confidence as well. So I would say those are the main reasons.
Very interesting. So, like, what misconception would you say that people often have about your job, especially at the level that you're at?
Oh. Well, interestingly enough, I would say the first misconception people have about me as a doctor is that I'm a doctor, which is very weird. They're like, "You're a doctor?" And sometimes patients ask if you're a doctor, which is it's like, yeah, I'm a doctor. It's okay. But I think in my current career in occupational medicine, people don't actually understand what that means unless they've had to see a doctor for a medical condition that can affect their ability to work. So basically, that's what occupational medicine is. So it's assessing a client or a patient and examining them and writing a report about how their medical conditions can affect their ability to work, and then making recommendations to their employer about what can be done to support their return to work, or whether they're fit to work or not fit to work. So I think people can have some misconceptions about you being the one in control of their job, which is not necessarily the truth. However, you want to support people in their journey and help them the best way possible to be able to keep their independence, to be able to keep their jobs and to remain financially free. So I find that part of the job very exciting, and you feel like you're really making a difference to people's lives in a tangible way.
You look like a superstar, so really, really great.
Thank you.
All right, so what skill, of all the skills that you learn over your career, which skill would you say has had the highest return of investment?
Oh, so the skill I would say has had the highest return of investment is communication. I think communication is necessary in every aspect of your life, in whatever relationships you're in. So be it with a spouse or partner, family, friends, and especially in the workplace. As a junior doctor, I learned very quickly that bedside manner, as they say, is essential to a patient's experience. It really makes a difference to a patient how you relay information to them, whether that is good news or bad news, using terms that are not too complicated for them. So avoiding medical jargon and breaking things down in a way that they can understand, and they can also have some autonomy in how their conditions are being managed. And also it helps the patient and the client partner with yourself in treating them appropriately and not avoiding responsibility on their side for managing their conditions the best way possible, but also it doesn't feel like they're completely excluded from the process of their medical decision making. Also, with my colleagues, communication is essential. Basically encouraging them in works that they're doing. If they're doing a great job, just a nice, well done, you did a great job here, you spoke really nicely here, or you handled this situation which was really difficult very well. And even in training, I've been involved in training in my current job with new starters that join the business, and I find it very rewarding to be able to mentor in a way the new starters that join and help them along their journey in passing probation and in settling in nicely into the business. So I would say communication skill is a massive, skill that needs to be continued to be invested in. Actually, it's not something that we'll be completely perfect in, but if we're intentional about practicing it and intentional about ensuring that it's something that we do on a day-to-day basis, then yeah, I think it will continue to bring a massive reward on investment as well.